Well, the legislative session in Augusta has wrapped, and there were a number of pieces of legislation that passed related to helping with mental health. And to discuss, we are joined today by Sweetser's president and CEO, Jane Van Bramer. Jane, thank you so much for joining us.
Thank you.
Yeah, we appreciate that. We like to talk about the things that we're working on and that we have funding for and that we theoretically could need more. Sweetser mentioned that funding for walk-in care clinics was at risk, and so how did the legislature address that?
So the legislature took a huge step forward by passing and signing into law LD 721. Now this bill, sponsored by Representative Annie Graham, will help stabilize and strengthen certified community behavioral health clinics across the state. So the CCBHC model is a best practice, and it really does foster greater availability of mental health and recovery services. And Sweetser has been a leader in bringing same-day walk-in access to the state. You know, we call these programs Hope and Healing Centers, and we have one in Lewiston, one in Sanford, and one in Brunswick. So we're just really pleased to be able to do this. This bill and the associated state funding will allow Maine to get enhanced federal match dollars. So it's great news, more federal money coming into Maine to support access to care.
Yeah, you and I have done many interviews and had many conversations about how important it is to meet people where they are. It is good to see that funding will continue for that.
Absolutely.
And we talk a lot about the National Suicide and Crisis Lifeline number 988. Is the newer number now part of Maine law?
Absolutely,
okay.
Yes. So 988, as you know, is the mental health equivalent of 911. So helping really reduce barriers to access, support, and help during a crisis. Maine officially cemented the 988 Suicide and Crisis Lifeline into state law. And this protects its permanence and also helps make sure it's integrated into Maine's behavioral health system. So by codifying this 988 into Maine statute, we're really able to protect it and make sure that it is a known number for the public, and that in the future we have then a benchmark for funding and for coordination. Really excited about it. So 988 for a mental health substance use emergency, you can text or call.
That's good news. And another story that we've been closely following is about youth mental health in particular. What are we talking in terms of psychiatric facilities for youth, Maine youth mental health? I know that this is a big one for us.
Absolutely.
Yeah.
So our psychiatric residential treatment facility did get funded. So Governor Mills included $3.4 million in her supplemental budget proposal for the capital construction of Maine's first youth psychiatric residential treatment facility. And after the HHS and the Appropriations Committee passed it, the full legislature supported the budget and included these critical funds. So, you know, the legislature really did step up to address a long-standing gap in Maine's youth service system for behavioral health. So we are really excited with this money and the previous $2 million that was already appropriated, and the current capital campaign, fundraising campaign we have going on now. We expect to start construction on this 16-bed facility on our Saco campus this summer. And if anybody would like to help with the project, or there are corporate sponsors who'd like to support construction, you can reach out to us at sweetser.org/buildhope, and that's what we're doing. We're building help and hope.
A little bit more fundraising to do there, but
Absolutely.
Really important for the state. We appreciate you coming in. Thank you, Jane.
Thank you.
Important stuff.